the big color.
Dr. Stephen Rich was named a top doctor in the specialty of neurology, seizure, and movement disorder by Baltimore Magazine. He specializes in movement disorders, including Parkinson's disease, related syndromes, as well as general neurology, including gait disorders and dizziness. Dr. Rich holds the Frederick Henry Prince Distinguished Professor in Neurology at the University of Maryland. Please welcome Dr. Stephen Rich.
Well, I want to welcome everyone to the MAPS Symposium. And before we get started, I really just want to, like everyone, I'm sure for the symposium, remember Rona Rosenbaum. and being instrumental in starting MAPS is only one of many, many accomplishments in her life. If you didn't have a chance to read the wonderful obituary in the Baltimore Sun, I would encourage you to look it up. So the charge from Rona when she talked to me about hosting this was about what it's like to have Parkinson's disease. Even though I myself specialize in Parkinson's, I really don't know what it's like to have Parkinson's. I do find that I learn a lot about that from my patients. For instance, as you know, slowness of movement or bradykinesia is a hallmark feature of Parkinson's. And one of my patients expressed it in a very graphic way. He said that the slowness is like going uphill through molasses in low gear. And I always remembered that, because to me, that draws a much clearer picture than just saying slowness of movement. But we do have a number of experts in what it's like to have Parkinson's with us today. And before letting each one of them have the floor, I just want to say that there are two large components to the symptoms of Parkinson's. The more obvious are the motor symptoms: tremor, slowness, stiffness, imbalance, trouble walking, etc. But equally problematic are the non-motor symptoms of Parkinson's. It can affect people psychologically, often autonomic problems, bladder, bowel, sweating, etc. Sensory symptoms, sometimes numbness or tingling or pain or an internal sense of tremor. Psychological symptoms with anxiety and depression, as well as sleep-related disorders, insomnia, daytime sleepiness, and dream enactment behavior. So Parkinson's is not just a motor disorder. And so I think I want to turn it over now to the panelists who were nice enough to volunteer and share with us some of their experiences with Parkinson's disease. So who would like to go first?
I'll be happy to go first.
Okay, good. And why don't you just introduce yourself to the group?
I'm Bobby Levin. I've had Parkinson's or diagnosed with Parkinson's rather, for about 3 years ago. I think my biggest challenge is my mind, because I'm afraid of falling. So my mind then takes over, and I'm so tentative and everything. It's like you were saying before, my motions are so slow. It takes me, instead of 10 minutes to get dressed in the morning, it takes me half an hour. Also, the depression, I can't say that I'm not depressed, but I try to move around that, because it's something that, as we're depressed, it only makes things worse, in my opinion. But multitasking is a big problem with me. Fatigue and exhaustion, I've never experienced that. If I don't take a nap in the afternoon, something's wrong. The one good thing in a way is I lost a lot of weight because I don't have an appetite. So I guess that's good or bad. But we have a lot of great people helping me with my balance, certainly helping me with my memory, my short-term memory. And that's about it. Otherwise, I feel pretty lucky.
Well, those are very common symptoms in Parkinson's, and often the emotional symptoms of Parkinson's, depression and anxiety, many times are overlooked by physicians, sometimes not voiced by people, but I will say that they're generally treatable. And so that's very important. The fatigue is a very common symptom in Parkinson's and often challenging to treat. Of course, we want to make sure that someone's getting adequate length and quality of sleep. Sometimes the medications for Parkinson's can contribute to fatigue. Sometimes tapering back other medications are important. The short-term memory loss is a feature of it as well. So those are all very common symptoms, some of which we can treat, some of which are tougher to treat. And I'm sure everyone listening to this will resonate with many of those. Someone like to go next? Thank you. Jerry, do you want to?
I can, that's fair.
Go ahead and just introduce yourself, please.
So my name is Jerry Doctorow, and I was diagnosed with Parkinson's in the fall of 2018 from a patient of Dr. Rich. So I say a couple things. No 2 days are exactly alike. I think there's your stress in your life, when you take your medications, what you take your medications with from a food standpoint, all vary, particularly the physical manifestations. And I think when I first was diagnosed, you read this like a death sentence. And I think my questions to Dr. Rich were, how long do I have? How long is it going to progress? Which I think every Parkinson's patient wants to know. And what I've found, I think, over time is I'm more in control of it than I thought I was. And there's great variability from patient to patient. But for me, doing rock steady boxing and having a really aggressive exercise program has been great. I mean, I've lost like 35 pounds since a little bit before I was diagnosed, since I stopped working, and I'm in much better physical condition, and that really helps offset the physical symptoms. This has been a crazy year for us. My wife was diagnosed with cancer, was had successful surgery. We had a grandson. My father-in-law passed away recently. So the emotional side of this it's just been a crazy year for me, and that's had an influence. But I think, again, you've got more control over, particularly through the exercise, than you think you do when you start. And that's important, I think, to understand.
Well, I would say we've really, learned a lot more about the importance of exercise, not just as a general, useful thing to do, but it seems to have a very particular effect on Parkinson's. So I'm glad that you emphasize that. And I think you're right. Go ahead.
I was feeling you've got some control over it, that you can fight it literally with the boxing. That psychology is helpful too.
Right. I agree in terms of maintaining strength, flexibility, endurance. Sometimes the fatigue is synonymous with poor stamina. So paradoxically, often the treatment for fatigue is to do more things that would build up your stamina. It's not always that easy. I think what you said about when you're first diagnosed with Parkinson's, people always think the worst. And with time, many people realize that, and I don't want to sugarcoat things, that maybe it was not as bad as they were thinking, or that they can continue to live, for a very long time with some modifications, but still a good quality of life. And Jerry, certainly exogenous stress can exacerbate the symptoms of Parkinson's as well. So you bring up a lot of important points. Who would like to go next? Gwen, would you like to introduce yourself, please, Gwen?
I'm Gwen Cookner. I am in my 14th year since I've had tremors that started. I've been in the MAPS program almost from the beginning. The first meeting I went to, Arthur Rosenbaum was giving one of the speakers. So I met Rona at that point, and she directed me to other things that were going on, and it's really been an absolutely terrific experience for me. I've gone through the exercise program, the boxing since it started. We went from 1 day a week to 4. So it's been great. I was thinking last night on how to approach this, and it's kind of falls under my umbrella of things my mother didn't tell me. And this is all foreign to me. My dad had symptoms of Alzheimer's, but I was not on site, so there was a lot that I didn't know. My sister was. This has been something that it seems like you find people, once you start talking about it, that everyone has someone in their life that has it, or they're trying to help, and most of us don't know how to help. I thought of things that had happened, changed within my body, trying to decide last night, well, what's the aging part, because I'm 75, and what may be Parkinson's. And listening to the other guys, I think more of the aging part maybe should be in the Parkinson side. The things that I really thought about, I have vivid dreams and I'm on medication for it. It's hard to describe because I don't know, I'm asleep. My husband has trouble getting me to awake at all. He has endured screams, fighting, evidently. I've asked him what punch him, what am I throwing in punches? Because you know, I am dedicated to this sport. And I want to, you know, am I throwing an uppercut or a cross? What am I hitting you with? And he just says, honey, I just want to try to keep you safe and me safe and get it stopped. So it's not fun for him, most definitely. And I think if I slept by myself, I'd never know because I am so in such a deep sleep. But it's been a really hard thing for him. And he lives when there's noise in the house. It's, are you okay? Because that's his first thought. I've learned a lot of new words. My vocabulary has gone up because I can't say most of them because I've never seen that long of words, but I do know diverticulitis now. Some of the other things that, and I don't remember if that's what is particular to me. Another is handwriting. I can't read the notes that I made last night because my handwriting is so terrible. My voice is going through a real major change, and I'm not a teenager. It's becoming very soft, very quiet. I feel like I am screaming sometimes, and my husband is in the next room and can't hear me. So that is taking some used to. I have the loud program, and I'm trying to work that in, where you repeat words in certain sequences that they help. They do, but I'm not using them enough at this point to make a difference. Freezing is becoming not just an occasional thing, but a daily thing for me. And it's hard to make my husband understand that if raising the volume of his voice does not encourage me to move my feet. I'm trying to move my feet now. And either I have my body weight is on the wrong foot or something else. It's just, I can't move. I know there are things that you can light that make a switch, and I have a walker that actually has it, but I haven't checked it because I've never had an extended period of time that the freezing was a trouble. It may before once or twice a month, but it wasn't a problem. I would just wait till it was over. Now it's becoming very prevalent in daily life. I have feet problems that with my feet have sort of tremors where the toes lap and curl. Sometimes I get my shoes on and I have to wait for one of my middle toes to straighten out so I can walk. It's just, it gets aggravating. And after so long, I think I'm getting aggravated, tired of it. But it's not, I'm not in pain. We're a lot better off than so many of our friends that have progressed further than we have. And I'm totally amazed at the wonderful people that I've met and known for many years, because they have extraordinary courage. The willingness to keep trying is what affects me very much, because I want to be able to do what they're doing. But I'm on a downward slope here. I've had a very difficult 7 months through the end of May. I keep falling. I've never had this problem before. I've fallen a lot, and I've had some really colorful eyes from, I used to always get facial hits. That's kind of changed. I'm now losing balance and just going softly down, but it's still down. And I had 2 instances late in the year where we had to call 911 because after we couldn't get up. And after an hour, we said, we'll do what Rona told us to do in the first place. And the fireman said, absolutely, if you can't get up, call us. And I've learned now how to get up through Patty's help. And so I don't think I'll be making that call unless I'm injured in some way. But it's watching your grandkids change and see how they look to you change has been difficult. I saw my youngest son and his kids just after Easter. And the 5-year-old said, Grandma, I thought you had brown hair. And I said, well, I did when I saw you last. But she said, it's gone gray. You're getting old. And I said, yes. Years ago, not long after I was first treated for my tremors, my granddaughter, who was around 4 at that time, sat down beside me and said, Grandma, what's wrong with you? What's happening to your arm? Because it was just dancing all over and I couldn't control it. And I said, Katie, I tried to be descriptive enough that she would understand, but not worry. And she listened and nodded and then said, is it contagious? And I thought that was a very appropriate response. And I told her, thank goodness, no. And she said, then it's okay.
Well, Gwen, I think what we want to do, I mean, you've brought up many of the more challenging problems that happen. I want to make sure that because we don't have a lot of time, I hate to cut you off, but I want to let some of the other panelists
Please do.
talk. And I just will say a few things, kind of some themes. I think group support seems like it's been useful to you. The dream enactment behavior, there are things that can be done. It can be treated with medication. I don't want to go into the specifics of that, but that's something.
Medication.
You mentioned about your husband and your grandchildren, and certainly Parkinson's affects everyone around the person, and that's important here. The freezing, there are some tricks for that. Sometimes the toe curling can be treated with botulinum toxin or with the timing of levodopa. So you do have a lot of challenges, but I think there are things that can be done to help. And it seems like that an important theme for yourself and others has been perseverance, that you're facing a lot of challenges, and we appreciate that. And we may have time to come back, but I just want to let Chris and Matt have time, and I appreciate you sharing so many things. Matt, do you want to introduce yourself and let us know what you've experienced?
Sure. My name is Matt DeWolf. I was diagnosed around 5 years ago. I guess I'm technically in that young onset group. I think, you know, the thing for me has been like the sensation of the lack of control or lack of trust in my own body sometimes. Um, excuse me. But, you know, it's all about the care team, frankly. You know, I've got a PT, I've got a masseuse, you know, I've got a therapist, I've got a movement specialist, as well as some community. And I think that's really important. You know, the other thing we talk about perseverance, but, you know, there's also resilience, but there's also adaptability, because the one thing that this disease brings at you is like, when you start treating it, I've noticed when you start treating it one way and you're like, oh yeah, I'm in a groove, I've got this figured out, there'll be a slight alteration, something else will change just a little bit. And that to me, I think is the, you know, is the adaptability component. You have to have the sort of fortitude that you are going to fight it, but you don't always know how you're going to fight it. So that care team is really important for that. We're living obviously in some pretty anxious times. And I've noticed the last few months just with work and life and all those kinds of things that some of our other panelists have mentioned, you know, life throws a lot at you. And, you know, I've found that, you know, even my threshold's a little lower for being able to deal with, you know, the sort of onslaught of things that might come at you, you know, left, right, and sideways, like a good hook. But, you know, there's medications that can work. And, you know, Dr. Reich, you and I spoke this week about, you know, some new medication. You know, probably can't tell it from my voice right now, but I have a great sense of humor. And I do try to keep, you know, a good sense of humor about myself and my interactions with people. But I think it's the lack of trust in my body. I think I was a fat kid, so I didn't do a lot of sports. So when I got in my 30s and I actually got slim, you know, I started doing a lot of cycling, and now it's like, if I'm getting ready to go out for a ride, I have to do my checklist. You know, when did I take my meds? Am I in that sweet spot for the medication? How's my overall stress level? Am I going to be able to handle anything that comes up on the trail? So, you know, those kinds of things it's an additional check. And I think maybe that additional burden of having to do those additional checks is what kind of lowers my threshold overall.
Yeah. Well, you certainly bring up a lot of themes that other people have: less control, less confidence in your body, to know that you can get from point A to point B successfully and not freeze or not fall. And I think the emotionality of Parkinson's is very important as well. And I think it's great that you can use humor as one way of kind of managing this, even though there's nothing funny about it.
Right.
When, you know, the choices are laughter or crying, sometimes laughter is more adaptive. Chris, can we hear from you? If you want to introduce yourself, please.
Glad to. Hi, yeah, my name is Chris Bentley. I am 52. I first had tremors 18 years ago when I was 34, when it started. I have a very, very slow progression. That's every doctor I've seen has commented on that. Very, very slow. So, I mean, I may not have seen you know, some of the symptoms yet that are really the more bothersome. But this far in, one of the biggest problems with me is the medication window slams shut, and I'm suddenly having tremors. You know, just like that, and it can happen anywhere. Sleep really rules the roost with me. I've had to become very bullish about my sleep, making sure I go to bed at a certain time, you know, and really keep a good schedule with that. Surely, right behind that would be slow digestion is a big issue with me. I find that my meds work best when my stomach is empty, and with slow digestion, basically you have to make sure that you eat just a little bit throughout the day. So it's caused a lot of changes that are more lifestyle changes, which is that's not too tough, you know. So that, you know, I want to echo something that I heard before, which is really, I mean, so far the worst part of having Parkinson's has been knowing that I have Parkinson's, and the actual lifestyle of having it has not been anywhere near as bad as I had imagined when I was first diagnosed.
But it does sound like a lot of your lifestyle does kind of have to revolve around it. I mean, yes, making sure you get sleep, you know, your eating schedule. And I think that must be very challenging to sort of throughout the day, you can't always forget that you have it. It has to be kind of something that you're cognizant about
Yes.
as well. And I do want to emphasize that everyone with Parkinson's, even though people have a similar set of symptoms, everyone's course is different. Fortunately, Chris, yours has been very slow. Sometimes the age at which it begins and how it begins can dictate that. So I just want to throw it out again. I mean, we've talked about a lot. I do want to say that for many of the things that you brought up, even Gwen, for some of the more challenging problems, there are often things that can be done to help the walker with the laser line, or using hiking poles can sometimes be useful for the freezing, the voice changes, etc. So I want to just throw it open now to any of you to bring up other symptoms or solutions that you have or coping mechanisms.
I swear by my therapist. That's one thing that I think everyone with any kind of disease should have their own individual therapist, and be picky about who you go with. Shop around, and when you find a fit, it's a great thing.
Do you refer to a physical therapist or a
I'm sorry, psychotherapist?
Psychotherapist.
Yes.
Good. And it actually should be both.
Sure.
So again, I think paying attention to mental health is really important. Almost all of you have brought that up. And it's really an under-recognized and under-treated aspect of Parkinson's. What else? We have just a few minutes left.
I think interaction with other patients is really helpful. I mean, we talked about the rock steady boxing and stuff, but seeing other people how they coped, some people cope with a lot longer. That's really inspirational, and I find it very helpful to have that interchange.
Right. I think we can thank Rhoda for setting this up, because I think she appreciated that. Just a couple minutes. Anything else that you want to bring up? I mean, I think you've covered a lot of the motor and non-motor symptoms of Parkinson's. I think, Gwen, you touched on affecting the family, and I think that's really important as well for caregivers, since it's a condition that affects the person primarily, but everyone who's in your family and your friend circle also can be affected, and you rely on them for good support.
Yeah, and how you present it to them and how you show yourself can set them, is very important.
Yeah.
If you're not scared, then they think they can go along, that it's going to be okay.
Yeah. Anything else as closing remarks? Mr. Levine, did you want to bring up anything else?
Yeah, I was going to say that I was glad and sad at the same time to hear that other people have the same feelings that I had, and
Right.
made me feel better about myself, to tell you the truth.
Yeah. Well, I think there is a lot of camaraderie in being around other people.
Absolutely.
You know, and also good just in terms of picking up tips for things. So I know for the actual symposium, we'll have a little bit of extra time for questions, and certainly you brought up many things that do require more time, but I want to thank all of you for being very open about sharing your experiences, and hope that it's helpful to everyone who's watching.
And thank you for doing this.
Thank you. Yeah.
Hope it helps.
Okay, very good. All right, thank you to everyone, and appreciation to our
Okay, so Dr. Rich is here with us today, along with some of the panelists. So at this time, you can go ahead and come off mute, turn on your video if you'd like. We have about 35 participants in this current session, so I do recommend that if you have questions, you put them in the chat. However, if you need to come off mute to ask questions, that's okay too. So I'll get us started off with one of the first questions asked by Barbara. Will slow progression of Parkinson's stay that way, or can it speed up in spurts?
Right. As a general rule, of course, there are exceptions. With Parkinson's, the past tends to predict the future. So the rate that it has been progressing is the rate that it will continue to progress. So in general, what you've said is true, that if it's been progressing very, very gradually, we expect that. The only sort of exception to that is if there's something that really changes it in a significant way, like a fall with an injury, that can really take you off of this otherwise gradual progression. And that's why we do our best to talk to people about ways to prevent falls and rely on you to be as conscientious as possible. But in general, Parkinson's is a very gradual condition.
Thank you. I guess this is a question for everyone, so including the panelists. Throughout the day, we've heard, the many doctors, therapists that a patient may be working with. Is there typically a holistic approach to care? Are doctors, therapists working together to find the best way to manage symptoms?
Well, I'll say that, yes, we should always be doing that. I think that's the best type of care when it's a real partnership, not just a partnership among the caregivers, but a partnership with the patient. Sometimes there is not as good of coordination of care as there should be. But yes, I think everyone involved with the person, Matt had mentioned seeing a physical therapist, Chris had mentioned seeing a psychotherapist. And I do think it's important that everyone who's involved with you, your primary care physician, et cetera, that we are working together. It doesn't always work that way, but that's the ideal situation. Sharing information, having similar goals and feedback.
And this is Matt. Sometimes you've got to be that connector. Dr. Rich and I talk, through a message service, and occasionally we'll get together on the phone. And, I don't see Dr. Rich all that frequently. It feels like I'm always doing something to help my Parkinson's out, whether it's going to get a massage, whether it's going to boxing class, whether it's going to see the PT. So I feel like I'm always working on it. So part of what I need to do when I visit with Dr. Rich is I need to let him know this is how I currently exercise. This is what I'm doing to sort of keep track of things. So there's a lot of communication just back and forth, as Dr. Rich had mentioned, that, I need to bring to Dr. Rich because he doesn't know all the time what I'm doing. And I don't expect him to. So, it's my disease and how I'm handling it and how I'm treating it and the actions that I'm taking for it, any dietary changes that I might have made and things like that, just kind of go into the file for later and something to be clearly communicated to everyone that's on your care team.
Would anyone else like to chime in? And also, as I mentioned, if you have questions, they can go in the chat, or you can feel free to come off mute and ask questions here. If any of our panelists want to come forward, maybe what you saw today reminded you of things that you weren't able to talk about during the session.
This is Chris. I do want to echo one thing that Gwen said, which was there are some awesome people in the world of Parkinson's. That's been a really nice surprise for me. I've been to information groups, I've been to Rocksteady Boxing, several different doctors, therapists, psychotherapists. It's been an overall experience with some really, really awesome people.
Very good. I think Bobby wants to talk. Let me help you unmute there.
There you go. I think I was saying this experience has helped me learn from other people how I can improve my life. Just have to take more control over it, obviously, but it's taught me a lot, and I appreciate everybody's input. And as Dr. Rich said, talking about their own particular situation was helpful. And I'm not going to talk about my situation because that would be horrible. It's a joke. I just try to get people laughing. That's talked about humor. So Dr. Rich is laughing too and smiling. So there we go. Anyway, thank you all.
What else? Other comments? It doesn't always have to be a question, but if you have a comment about your own experience, please offer it up.
any suggestions about how to keep the Parkinson's patient motivated to do the good things that are out there for them?
Yeah, yeah, Ms. Kochner, thanks for asking that. And that does, kind of to back up a little bit, is one thing that can happen with Parkinson's, one of the non-motor features, because it can sometimes affect the connections or the frontal lobe of the brain. Sometimes part of Parkinson's can be decreased motivation on a very physical, organic basis as part of the disease, sometimes associated with apathy. We always have to make sure that if someone is not motivated, that it's not a part of depression or sometimes anxiety, because that can be very treatable. So that's one. But when it's not, and it's really a change for the person, it's often a physical aspect of Parkinson's. So it's kind of like saying, how can I get them to be less slow? Meaning that it's a tough thing to do. I think having a routine is helpful. Trying to make goals is helpful. I think those are the tips that I can give, but I think ruling out depression, ruling out anxiety, recognize that the person's not trying to be obstinate or difficult, that they really may truly have a physical, defect affecting their motivation. So trying to figure out what they are motivated to do and encourage that. Routines can be very helpful. And I think gentle pushing, understanding that it's more than just simply someone being lazy. It can often be part of the disease, and that can be challenging, but continue to push and encourage. I think those are the key things. And I know those are things you do too. What else? And I'm happy to hear comments from others about how you keep yourself motivated or your care partner motivated.
So one of the small things that I've taken on as a personal motivation, it's a small passage, and I get to look at it every day during work from home because a friend turned it into a piece of art for me. And it's simple. It's do the next right thing. And there's a really good podcast on NPR's Invisibilia about Parkinson's, I believe it's about the English woman or the Scottish woman who can actually smell people with Parkinson's. And that's a great Invisibilia passage. But one of the takeaways from that is just that small phrase, do the next right thing. What's the next right thing to do for your day, for your Parkinson's, for your care partner, for your spouse, all those things.
Right. Sometimes breaking what seems like a mountain into very small pieces, I just say for myself, can be helpful. Just if you can just start and do a little something, sometimes that's better than not doing anything at all.
Right. I'm a project manager by trade, so everything is taking big jobs and breaking them into small, accomplishable tasks.
Yeah. What else? What other comments or tips do you want to provide to the group? Questions?
I think one of the things that I also try to do is try to appreciate people who are trying to help me and not, cast them on the side or whatever. That, I can't do that. If somebody's willing to help me, I should feel privileged enough to work with that person, especially my wife. I just want to say something good about it because you never know.
You are so funny. You are so funny.
That sounds like Judy in the background. All right. Well, on that note, time flies when you're having good company and conversation. We have one more session remaining, our closing remarks for our event today. So I want to add that I included in the chat an email address. Should you have any questions or comments after today's session, feel free to email it there. We're happy to share it with Dr. Rich or any of the panelists here at that. And I want to thank Dr. Rich for joining us and for also spending some time last Friday helping to facilitate a very interesting conversation with everyone.
Good.
So,
and to thank the panelists especially. And finally, just one more note and kind of memory of Rona. And, our best wishes to Arthur here. It was really, a great tribute to her, this symposium. And like I said, she was the one who proposed that we have a symposium or one of the sessions about what it's like to have Parkinson's. So we have great memories of her. So thank you to the participants, the panelists, and those of you who have listened as well. Thank you.
Thank you.
Thank you, everyone. I'll put in the chat once more the link to return to our main page so that we can go to our closing remarks. Thanks. Have a good rest of your day.
Well, if I say anything more about Rona, I would have just dissolved into tears.
This completes our current session. This meeting will end in 1 minute. Please proceed to meyerberg.org/LWP and click Join Session of the next session. Thank you.